Peterson, Wachira, thank you very much for coming by today. Kenya Union Clinical Officers Chair. Appreciate your time. So let's just start with the basics. Of course, one clinical officer was infected with COVID-19, and you guys had a statement, and you said the government is not taking this case seriously or treat it with the urgency that it deserves. So can you just tell us that particular statement, because the government, according to them, they're doing all they can to ensure that all health workers are taken care of?
I think let me say that, and thanks for having me, and thanks for also bringing me here to air our plight as health workers. Let me say that in any outbreak, because I also have an experience with the Ebola outbreak in West Africa, you will never be 100% prepared.
Okay.
But there are basics that must be seen to be done by a government early enough
Okay.
for containment of the same and the mitigation of the outbreak.
All right.
One of them is that you must ensure that you are having enough staffing, adequate staffing, because one of the realities with any outbreak is that you must lose some of your medical workers to quarantine, not lose them like they die,
Okay.
but some of them will get infected and you'll have to quarantine them. When you quarantine them, you must have a reserve force, so you must recruit more.
All right.
Number two, you must train them. And the training that you are doing, it must confer confidence that they can be able to use the protective mechanisms you have put in place, and that will make them take care of the patients. We ran a study this weekend, and a whopping 68.1% of health workers, not clinical officers, because we did as the union for doctors, for clinical officers, for nurses, for lab technologists and scientists, and for the pharmaceutical technologists. 68.1% say they have not been trained.
At the moment.
Yes.
Okay.
68.4%, they say they have not been trained on how to use a PPE. Because actually a PPE, if used wrongly, becomes a source of infection. And we have seen so many people infect themselves when they are doffing off or removing the PPE.
The PPEs, yeah.
Of course, the third thing is that they must provide the protective gears early enough. Those are the basics that the government should actually start with. So to that extent, I think we lagged behind. Our government lagged behind a bit.
Okay.
And that is why, because our role as the leadership of the unions and the leadership of the employees, as per the Article 41 of the Constitution, is to ensure that everybody has a safe working environment and also remuneration, because also they must feel that they are appreciated in terms of they have a risk allowance that is commensurate.
Yeah.
Because in the same study, we also asked them to tell us what protective equipment they have.
Okay.
75% of them,
Okay.
they only have gloves and masks.
All right.
They do not have the other components that make a personal protective equipment, and that includes, there is a cap, there is a coverall, which is an overall, there are boots,
Yeah.
there is an apron. They do not have those things.
Okay.
And what that means is that most of them, they will either not see the suspects, or if they will see the suspects without their knowledge, they will be infected. And that is why we can see that the number of clinic officers especially, because we are the most at risk.
Yeah.
And we are the most at risk in this way, that when you come to a health facility, you'll meet a nurse who will triage you, probably for 2 minutes in an open space.
Yeah.
But then because of confidentiality, you'll have to sit with me, a clinic officer, for about 15 minutes in an enclosed room, because we have to ensure confidentiality. And I have to take my time, like 15 minutes according to WHO standards, so that I can diagnose you. By the time I'm diagnosing you and saying that you might be having COVID, you have already infected me. That is why by that time it was one person. By now we are having 3. We have 2 more in Mombasa who got infected locally, not imported from outside. they were infected in line of duty.
Okay. Talking about the number, 68.1% say they have not been trained, and yet the government said, especially on the onset of COVID-19 in the country, they said they're targeting over 5,000 health workers to be trained. So then, what does this say? Is this enough? Is this not? Because 5,000, first of all, is it enough to deal with then the cases which are actually on the rise in the country?
Number one is that we have not trained 5,000.
Okay.
The reality is, the last time I checked, we were about 1,200. Because what happened, they only trained some trainers of trainers, a few people in every county, so that they can train the others. But now, there is a question. Then they didn't have the funds to continue training within the counties. I have seen some of the trainings being offered, and we have raised this concern even with the Ministry of Health, that actually they do not meet the standards. Because for any training to be said to be effective, it must confer confidence on that person, so that they feel that after this training, I can actually handle this person with COVID-19, and I can be confident that I'll be protected by the protective gears that I'm using.
Okay.
But with 75.1% not having been trained on how to wear and remove a PPE, you can be sure most of them will not be confident, because an online or a 2-hour CME cannot actually be able to do this. For example, when we are going for Ebola fight in West Africa, we got a 4 days training locally, and when we went to other side, we got a 4-day training, and the last day is actually about the PPE. You wear your protective equipments, and there are simulated case studies where you go and see patients. Okay. So after that, you are very confident that I can be able to use this, and I'll not get infected, and that is why out of 178 Kenyans, nobody was infected. We came back without anybody of us being infected, because training really matters. Okay. You can give people PPEs, but if they don't know how to use them, they're actually going to be infected from those PPEs that you gave them, and you are going to actually lose medic.
Okay. So then essentially, because now it's actually a race against time, because then the numbers are increasing. Probably we do not have the luxury of time to offer probably adequate training, or as what you're saying, according to the standards. So then what happens? Can't you sort of like squeeze in the 2 hours to ensure that at least you get the basics, and then the rest probably learn on the job as you go on? Because we don't have time.
You see, time is always there.
Okay.
And we can either have time for training, or have time for barriers. Because if you don't train them well, if they don't have the confidence, if we do it in a rushed manner, then we get them infecting themselves, infecting more Kenyans. They even become a source of spread. Then we have so many medics quarantined. We have few to see the patients. We are going to get a surge in the cases. And then we are going to start getting cases like we are seeing in China, in US, in Italy, and in Spain. So I think 2 days, we can maybe squeeze it into 2 days. We have enough capacity in the health workers who can train. Because we have also been trying to propose to the ministry 168 people, plus the ones who have been trained, provided with facilitation, we can actually train the whole country in a week. In a week, we'll have covered the whole country. Then we'll be able to cascade down and take the PPEs. And then the moment we take care of the medic, I can assure you the population will be taken care of.
Okay. Yeah. All right. And then in terms of talking about remuneration as well to all the health workers, not only clinical officers, the government is somewhat short of funds. There has been an M-Pesa pay bill number that was set up to, Kenyans and organizations to just come and try and help in one way or the other. And then here on this other side, the health workers are asking for some sort of remuneration. Isn't that,
you see, what we are trying to say, is that the government must be seen to appreciate the health workers. And this is not a problem that has come with COVID-19. This is an outcry that has been there. Let me give you some examples. A clinic officer, who I'm telling you is the first line, and it's evident because you can see they're the first medics to have been infected locally. 3 of them now. We earn a risk allowance of 3,000, the lowest in the field actually, with the highest earning 20,000. So how will that clinic officer feel appreciation from the government when they know they are the first line, the most exposed? Number 2, we are having some of our members, not clinic officers only, employed on some very, very humiliating contracts. In Naivasha General Hospital, in the Nakuru County Hospital, the former Nakuru PGH, we are having clinic officers, nurses, laboratory technicians, pharmaceutical technologists employed at 25,000. After deduction, they are getting 18,000. How can you tell this person that those are public facilities? How can you tell them that their government appreciates what they are doing?
Wait, but you guys swore to save lives first, and then all these other things will come by later.
That's basically what we are doing. We have not gone on the streets. What we are doing is that we are continuing with work. We are even innovating where we can. The clinic officers, I'm telling you, have been infected. They had the option to refuse because there were no protective equipments to see patients. But when you see the suffering of the patients and you know you are the only person who can help, I think it's inherent upon us that sometimes you feel that you just have to help, and sometimes you actually put yourselves in the harm's way. But we're also telling them as a union that if you know for sure this is a COVID-19 suspect and you are not protected, please do not try to assist because you'll put yourself at risk. The patients you would have saved tomorrow, you'll not save them and they'll die. So it's better you retract, you look for protective equipment, or you ask for somebody with the protective equipments to come and see that patient.
So then moving forward, before all these things and before the PPEs become perfect, because you see, when we talk about PPEs, probably a person watching us might be thinking, but at least you have it. Can't you start using it before it becomes standard or up to par, able enough to protect you guys from getting infected from the same? So what happens then moving forward before we get then the perfect PPEs for a person?
So number 1, we don't have it. They're manufacturing. I only saw some samples. I think we are starting to get some confidence that maybe we are going to get adequate, and we're also very happy that they're actually locally made. It's our people who are benefiting. But on the side of training, and I will keep on insisting, the WHO Director General has also said this, that training is a basic that cannot be wished away. Because actually when removing PPE, even in the cases of Ebola, most of the medics who were infected, they were infected when they were removing their PPEs, because there is a procedure you need to concentrate on when removing so that you don't contaminate yourself. And the same might happen here. So it's not only the PPE, it's the PPE plus, of course, you have to be sensitized on how to use it safely.
Because confidence is what they really need.
Confidence is
to handle the same. So then again, what are you doing in terms of then preventing a lot of cases? Because so far we have 3 clinical officers who have been infected, to prevent then the numbers from growing, especially amongst the health workers, because again we need them aside from PPEs, aside from then or other cases of risk allowance and all those things. As health workers, what are you doing? Because I've seen in the US some of them had to improvise some of the office supplies to make them as PPEs to work. Yes, and the trash bags as well.
So what we are doing is that we are also trying to, in some cases, we are trying to use what we can. You know, sometimes even the supplies like trash bags are even a challenge in our facilities. So what we are doing is, number 1, we are telling them that ensure in the facility you are in, Number one, the waiting bay is not overcrowded.
Okay.
Number two, you don't see your patients in an enclosed room. Number three, have a separate area where any patients with respiratory symptoms or who may have came into contact or had traveled should, with a good signage, that they should be able to be seen in that separate area. You can actually make a tent.
All right.
So that the suspected ones, the respiratory cases, you can see them separately in an open air where you have maintained your distance and of course with the protective clothing, because now that will mean maybe only a few of you will require to have them, and maybe the advanced ones.
Okay. Okay.
And so you'll save the supplies so they can last longer and you can be protected.
And then very, very briefly, as we finish, in terms of then the level 2 and 3s in most counties, you see most of them are not equipped to handle such cases, and probably clinical officers are the first persons who then deal with these persons, when someone comes. So then what would you want, especially for the government, the Ministry of Health and county governments, to sort of do in terms of making sure that, fine, in as much as it's not like level 4 or level 5, but it's able to accommodate some of these cases that might present themselves, especially in rural areas?
That is why we want everybody trained, not a specific category.
All right.
Because some of us, like myself, for now, I'm actually ready to go into an isolation.
Okay.
I'm even training myself.
All right.
But I'm not talking on behalf of myself. I'm talking on behalf of that person who is most at risk and the person that we must be able to protect. So we want them trained. We want them to have PPEs. We have the reorganization of health facility to reduce the risk, the overcrowding, to have a specific area where these people can be seen.
Okay. All right, Peterson, Wachira, thank you very much for coming by today. And of course, just understanding some of the plight, especially for all the health workers and not only for clinical officers. So I hope that this will be sorted as soon as possible so that we can halt the spread of COVID-19. Back to you.